Hello, ladies and gentlemen. Welcome to the show, the Lagosian New York City show. I have Totti and Aji here, and we're talking about relevant issues going on in Nigeria right now. Boys, now welcome, man.
Yeah, it's good to be here.
So I'm sure you're aware of the ongoing resident doctor strike. For those who don't know, resident doctors are pretty much doctors in training that run a lot of the teaching hospitals where we see a lot of patients who are, non-private hospitals. We also have resident doctors in private hospitals too. But this strike issue has been ongoing for decades. It's almost like ASU strike, never ends. And I kind of wanted to just pick your brains as to what's going on. How can we fix this problem? Everywhere you go, there are doctor countries are trying to recruit Nigerian doctors because as bad a reputation as Nigeria has, Nigerian doctors have a good reputation overseas. Is that right?
Definitely,
Yeah.
definitely.
So countries like Europe and in countries in Europe, America are trying to find Nigerian doctors to come over to serve and take care of their patients and get paid well. So Totti, Aji, what's the problem? What's the solution? Is there no solution? When will the health sector fall off a cliff, as they say? Because there will be a breaking point at some point if doctors are not well paid, people continue to leave. There will be some kind of breaking point.
Well, let me take it. It's a sad situation, and I really don't like to be commenting on that because, personally, I could be counted as one of the diaspora people that left. But that be as that as it may, the bottom line is my own perspective. There are two reasons why people leave, doctors, leave Nigeria. One is because of poor remuneration and money. Two is poor working conditions and lack of facilities. All other issues can broadly be, the major issues can broadly be accommodated under those two headings. And as anything in this world, supply and demand and, water goes to its own level. As long as the situation in Nigeria is tough like that, there will always be, different countries that can take advantage. I was discussing with a friend and I said specifically that, look, there was a recent recruitment exercise by the Saudi government that they came to, I think, Lagos and Abuja, or recruiting physicians. People had to pay, whether it was a 5K or 10K, I've forgotten how much was the application fee for vetting. And there were not only resident doctors, even consultants were there.
Wow.
One of the people that were interviewed was saying, I saw my teacher, a consultant pediatrician, in this interview to
Wow.
check out to Saudi as me. Why is that so? Because of those two reasons I said. So until those two issues are addressed, however they can be addressed, I don't know. These are deep issues. Nigeria only spends less than like 3% of the GDP on healthcare sector when the recommendation is 15%. Where are you going to get that money from? I don't know. But somehow, somewhere, until those issues are addressed, this phenomenon will continue and will even escalate.
Aji, any thoughts?
Well, so my thing is this, yeah. I feel like healthcare is expensive. That's my thing. And when I say it's expensive, I mean it's expensive to fund healthcare. It's expensive to pay doctors, to pay nurses, and other ancillary stuff. It's expensive to run a hospital. It's expensive to run simple tests and get the results back on time. In Nigeria, we have a funding problem. And the thing is this, the government can't fund healthcare. They can only support healthcare and provide an atmosphere for healthcare to thrive.
So you're saying that government can't
So
fund? Is
so
that like
so
an
so what I,
absolute?
what, what I'm saying is this, yeah. In most parts of the world, government doesn't pay for healthcare, it pays for itself. The government
Yeah.
provides the enabling facilities, the laws
Oh,
to make it pay for itself. Let me give you an example. In America, we have Medicare.
NHS.
In America, we have, I'm even coming to Medicare. We have simple Medicare in America.
Mm-hmm.
Whether you have
Tell,
insurance or you
tell
don't have
people about
insurance.
Medicare, G, because people listen and
So
they
Medicare
don't have
is,
a clue. If you don't live in the U.S., you may not understand how Medicare
yeah.
pays for your health or how.
So
Yeah, how does it work?
Medicare is just it's pretty much a government program that everybody contributes to as long as you have a job. It's not voluntary. You have a job, you pay towards Medicare, and it only kicks in when you're 65. At that point, the government can take care of parts of your hospital bills, the major parts. Of course, you still need other ancillary insurances to help you cover your drugs, outpatient, things like that. But the bulk is paid for by the government. But again, as soon as you're 16, 17, 18, once you have a job, you start paying into that particular purse.
And it's deducted before you see the money, right? It's
exactly from the source before you see the money. So what is that money? Where does that money go to? It's collected from everybody. It is invested, and then when you are 65 and you need it, it's available for you to use it. That is one way in which the government ensures that in your old age you have health care. Now, before 65, they're on your own, which means that you have to buy your own health insurance and pay your own way. What I'm saying is that in Nigeria, we have no insurance. Prior administrations have tried to create those kinds of schemes. For one reason or the other, it's not working. So what I'm saying is this: we need to fund healthcare. Apparently, our government is so corrupt that they can't even fund simple primary school education. Now, not to talk of healthcare for the whole country, which means that we have to find a way to fund it such that we can pay doctors and they can stay, and we can also care for patients. So pretty much in Nigeria, what we need is like the NHS, where everybody contributes. Once you have a job, like hook is not optional.
Ajib, but practically, good idea. But
But the thing is,
practically, would that work?
but the thing is this.
People
Yeah,
still
listen
chop
to
as
me.
long as corruption is still there.
No. So listen to me. Yeah, this is the thing. People pay taxes every day, right? So just add the healthcare tax for everybody. Now, of course, you now have to have a management company that will manage those funds. They now chop it, it's over, which is not impossible.
Yeah.
Do you understand? I'm just saying that we have to find a way to pay for, because our government is not responsible enough to care for everybody, which is apparent.
Yeah,
And
but I think
healthcare is too expensive.
our
It's too
population is
expensive.
huge. Because if you think about like the Kingdom of Saudi Arabia, Bahrain, all those oil-rich countries, some of them take care of the health of their people, but they're not as big as Nigeria. That's the problem.
So you're hoping that the thing is, so what you're doing is you're hoping that we have a big population. If we have a growing economy, people have jobs, then there's a bigger pot. If you keep them healthy, then less people will need health care. So what do? Health insurance, everybody pays towards it, and then you strengthen primary care such that less people get admitted to the hospital. It's one option we have, because I don't see how else we pay for healthcare.
Yeah,
If you can't pay for healthcare, doctors won't get paid. They will keep living. We can't get the scans we need. The MRIs we need. Nobody will pay for those things.
Countries like Fiji, Trinidad, and Tobago, the economies are not as big as Nigeria's economy, but yet they have better health system. Nigerian doctors leave Nigeria to go to the Caribbean to practice. That's a shame. That's a shame. It should be the other way around, where people are coming.
And it's the priority of the government, because I feel like, again, the government officials, some of them I feel like, well, I can go to the UK, I can go to America to get healthcare. But the thing is this, but the thing is this, those of them that can think and reason, even with this pandemic, it's obvious that they lost friends and family.
Exactly.
Because they couldn't get a flight.
I saw pictures about some government people whose relatives died, with all the billions, if you can't fly,
So if you embezzle the billions and you don't provide the hospitals and the oxygen for people to use, at some point to bite yourself, because again, it will bite you. It's going to eventually, because again, you can have heart attacks. Don't wait for flight tickets.
Yeah, they don't.
Don't wait for evacuation flights. You get it, you're down on the spot, because there's no cath labs. So I feel like I hope that this pandemic will at least, bring people in power to reason and see that these things can't wait.
The president's still traveling.
Healthcare can't wait.
I just think at some point you have to. There has to be some kind of enforcement that comes. You can't travel on tax dollars, on tax naira, on Nigerian, in the back of Nigerians out of the country. If you can mandate that people now take the healthcare, all the hospitals in Abuja at least we'll start to see resources. I met this doctor who came to the US, works in one of the Nigerian, either one of the hospitals here in Nigeria, and he said he knew that money was being released from the federal government every year to buy. He's a pediatrician, to buy incubators and buy all that kind of stuff, but that it wasn't trickling down. That he would know that this was released. That every time they are fixing something, it never gets finished. It got to a point where he was taking care of babies and was having to give the parents of the babies money to go run the blood test outside his hospital. So the baby's in his hospital he's caring for. He gives the parent money, go do the test, then he runs. At some point, he just got heartbroken and he left.
And this is the thing, yeah. I feel like, in Nigeria, we have the federal government's hands into everything policy. I think things should be broken down to the state level. We have those structures in place, but they are not empowered. What is the Federal Ministry of Health doing with supplying CT scans? Why? Of course, you know what I mean? It should be down to the state governments. Of course, for federal hospitals, maybe, but I feel like there's so much. So what I'm saying is just the fact that before the money gets down for Federal Ministry of Health to local government, that disappeared.
Different.
That disappeared.
Okay.
You know what I mean? So it's just it's a broken system.
My feeling, my feeling in this is twofold. One, yes, there's a big role in government, and government is abysmal performance when it comes to healthcare for decades. This is not a new problem since the days of the glory days of research in the 60s, 70s, and I don't know exactly, but probably started fading by 70s and 80s, as with basically the fortunes of Nigeria basically turned around those periods anyway, 70s and 80s. Well, I'll just wrap up by saying, yes, the resident doctors strike is a specific strike because they are, by and large, they are resident doctors. Most programs are run by the government. There are very few, if any, private. I think there are a few private residency programs. I know of one ophthalmologist that finished in a private residency program. I don't know if he would have joined this strike, but I would want to say, to me, a light at the end of the tunnel should be more investment from the private sector into healthcare. The private sector cannot solve the whole of healthcare. Don't get me wrong. The private sector is never going to take care of primary care. Those are things that they have a lot of benefit, but they are more services that the government should do. But in terms of just capabilities and technologies that will help specific groups of patients, I think the private sector has a huge role to play in Nigeria. And I think that really, if I'm investing money as an entrepreneur, I would want to invest in private sector healthcare, because when looking at, I was in Lagos sometime, I went to a particular diagnostic facility. I won't want to mention the name here. And there were so many patients there looking for basic scans, CT scan, blood tests, lab tests, looking for quick, reliable tests. And the treatment and the customer service was a bit shabby. I was looking at it that this is an opportunity for somewhere that has very good customer service, very good, reliable tests. If you set up a competing establishment there, you would make your money, because the demand is so huge and there are inefficiencies, so many areas from the big facilities that can be tapped. Also, likewise, I know private hospitals must be doing well, or fairly well, some of them, because they deal, they have private employees that are not part of the strike, and they have, their payment is cash, very mainly cash. Most of them don't do insurance. In India, there are a lot of good hospitals that are purely private. They have nothing to do with the government, and people from America go there for heart transplant, different things, advanced therapeutics. That is, again, I'm remarking, this is not the solution. The solution is good government investment, primary care. But in terms of, catering to a certain niche of the population that needs some of these highly specialized treatments, I feel the private sector has a big role to play in Nigeria. And I want to see some hospital groups take up that challenge, or some facilities, big hospital groups.
Okay, Aji, final word.
Well, I think Dottie has touched on a few points, but I feel like, again, private hospitals are important, but they don't do much for everyday Nigerians. They require 2.5 million, 2 million deposit before they even see you, which most people cannot even afford. Of course, if we have private healthcare groups, consortiums, like you have in America, that can manage healthcare systems, like the like general hospitals, other private consortiums, so they can be run by private entities.
Yeah,
And
that's why.
then they can get government subsidies. Like, all over the states, you have, county hospitals. There are county hospitals, but they are run by private companies. But they get bricks from the government, from the county. They get tax dollars to help them stay open and run efficiently. Something like that. But again, all that is on the back of a mode of payments.
Yeah.
You know what I mean? Because if you have indigent patients that can't pay, then how do you run a hospital? Here we have insurance, we have government safety nets, and then we have MTALA, which means that the government says we'll give all these tax dollars, but everyone that comes to your ED has to be seen. Otherwise, you're going to get sued and they'll shut you down.
Yeah.
So things like that we need in Nigeria, but we need private healthcare groups to take control of government hospitals, and then the government can give subsidies and just help them out whenever they need help. But governments managing healthcare won't work.
Okay, guys. Excellent thoughts, excellent summaries. Hope someone is listening. Hopefully we can channel this discussion and finish it up another day. My people, have a good night.